Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. I shall be talking on UTI, Urolithiasis, laboratory diagnosis and prevention. It's a very long word. The UTI stands for urinary tract infection, and these are infections that are very common with women, especially those who are in the menopause range over 65 years. The UTI infection, because the resident normal flora in the occupying the region, the urogenital region of women, at that menopause age has changed from the lactobacilli and predominantly E. coli. So this situation really makes the protective mechanisms of the lactobacilli that produce acne allow all these other organisms to multiply and cause urinary tract infection, especially the lower level. For men too, because as men grow old, the prostate enlarges, and so the urine flow, it becomes a problem, and you now have a situation of urinary tract infection also happening more in men as they grow older in age. Regardless, these are things that we want to know, understand, and then look at how we can treat it, how we can prevent and treat it. The first thing is to diagnose, and that's where my area of competence is very prominent. Urolithiasis has to do with formation of kidney stones or urethral stone. The location of the stone is just within the urinary tract, the urogenital system, and the reason for it is now well exposed because the normal flora that we used to think that that region is sterile, but no longer, after a serious study of the microbiome of that region, or you call it the urobiome of that region, has now been found that it's no longer sterile, but there are organisms there that we don't usually identify, and that I shall expose in the slide section as we go on. So click the like button, subscribe to know more so that we can know how to prevent and also the possible treatment when we come down with all this kind of problem. The outline: objective, introduction, prevalence, laboratory diagnosis, and prevention and treatment are all I shall talk on there. The objective: to create more awareness about the update on laboratory diagnosis of urinary tract infection and urolithiasis, their prevention and treatment in order to reduce the time. The introduction: urinary tract infection is straightforward, without any ambiguity, infection found in the urogenital system. The urinary tract consists of the kidney, ureter, bladder, and the urethra, from where the infection ascends, which is shorter in women and could explain why UTI is very common in women, especially menopausal women. The common symptoms are pain or burning sensations when urinating, frequency of urination, lower abdominal pain, cloudy or smelly urine. It could graduate to fever, flanks pain, nausea, and vomiting. It is usually caused by E. coli that is resident in the rectum. That though you have a particular strain, pathogenic strain that is very close, and that will really cause this problem when found in significant number. Urolithiasis: this is a condition when stones form in the urinary tract. It usually begins as kidney stones. Nephrolithiasis: with the understanding of the urobiome of the urinary tract, that is the resident organisms, that is resident normal flora of the urinary tract, which nullify the earlier notion that we used to have that the urine in the urinary tract is supposed to be sterile and stuff like that. But now it has been found that because of dysbiosis that displaces the beneficial lactobacilli that are resident in this area. The E. coli and all these other organisms that come in to populate the area is what we now consider as significant. And because these organisms that populate that area now can easily be grown. So these crystals are formed because of E. coli especially. More explanation. There is this experiment that was done to assess whether the kidney microbiome affects stone formation. The researcher cultured bacteria in special chambers that stimulate urinary flow within the kidneys. They then introduced calcium and oxalate, the primary component of calcium oxalate kidney stone. The uroprotective bacterium Lactobacillus crepatus and a strain of E. coli associated with stone formations were shown to affect the crystallization of calcium oxalate by incorporating calcium oxalate inhibitor and promoters in different ways. In E. coli culture chambers, large stones like crystalline structure formed. Chemicals and X-ray analysis confirmed that these structures were identical to human kidney stones in chambers where Lactobacillus crepatus grew. No kidney stone formed. That really confirms that E. coli is especially involved. Yeah, prevalence. Globally, about 150 million people are diagnosed with UTI annually, with women 40 to 50% having a higher prevalence than men. Especially pregnant women, that shows a significant higher prevalence, as high as 35% of pregnant women. The prevalence of urolithiasis ranges from 1% to 20% and very high in developed countries. It is higher in men than in women and is more common in adults than in children. The laboratory diagnosis. Midstream urine is collected in a sterile sample or universal container. The process, you first of all clean up the genitalia, dry it up, and make sure the urine pass out. The first portion of the urine is passed out, and then the middle is pee inside the universal container, and the terminal one is passed away too. So urine culture are plated quantitatively using a calibrated inoculation loop, and the culture is incubated overnight 24. So the next day, you look at the count. If it's up to 100,000 CFU minute, which is seen as 100 based on the quantity you inoculated. If you inoculated 1 or 10, it will count 100. 1,000 or 100 respectively. The latest method is to do the DNA or RNA amplification sequencing to know whether the ribosomal RNA, which is very specific for all bacteria, you now use it to identify the bacteria present here. So some fastidious bacteria are now being discovered, and using even larger volume from what is displayed here, up to 100 allows one to see these fastidious organisms, and even some organisms that grow anaerobically in an anaerobic environment are even found these days, because the microbiome of that area has resident organisms, which helps to really confirm whether it could progress to urolithiasis. Prevention and treatment. Both conditions occur in the urogenital system, and as such, whatever precaution taken must have a positive effect on both. So you do not take something that will be counterproductive, where you are treating this and then encouraging the other. Calcium oxalate stones affects 8.8% of the population in the US, which shows clearly that developed countries eat more than enough proteinous food, and as such, oxalate, which has been identified, oxalate is an amino acid, has been reported in 75% of urinary stone. Oxalate is produced from amino acid metabolism. Because it is toxic, it must be excreted by the kidney. So that's where it now piles up. And once there is a little dehydration, it clumps. And there is a correlation between oxalate excretion and kidney stone development. So decreasing dietary oxalate and calcium intake would likely reduce such risk. Then you can think of the probiotic, taking Oxalobacter formigenis, which helps to decrease the risk of recurrent stone formation by 70%. And you now take it just like a probiotics. And because it's anaerobic, it resides in the human intestine, it uses the oxalate as main carbon and energy source. So in doing so, it reduces the oxalate excretion. Number 3, drinking enough water helps both conditions, especially as urination reduces the population of these organisms. And our treatment remains antibiotic based on the most susceptible and also the discretion of the clinician. Pain relievers for pains and it is advisable to reduce protein consumption, just like we have seen that the oxalate, especially those crystals that are calcium oxalate or kidney stones, stones that are formed from calcium. There is the uric acid, uric stone to all the other ones, but majority of all these crystals are proteinous formation, so or breakdown of DNA with the uric acid. So many production, you can't always watch more. We have 202 videos on this channel.